Hey moms-to-be, are you wondering if your baby is getting ready to make their big debut? Well, you're in the right place. In today's video, we're breaking down the 10 clear signs that labor is near. So, if you're in your final weeks of pregnancy, you won't want to miss this. Let's jump right in. 1. Baby drops, lightening. When your baby drops lower into your pelvis, it's a sign that labor is approaching. This is called lightening, and it can happen a few weeks or even just hours before labor starts. You might notice it's easier to breathe, but at the same time, you'll feel more pressure in your lower abdomen. Hello, frequent bathroom trips. 2. More frequent Braxton Hicks contractions. Braxton Hicks contractions, also known as practice contractions, can become more intense and frequent as labor approaches. Unlike real labor contractions, these are irregular and don't get consistently stronger. But if they start getting more rhythmic and painful, stay tuned for sign number 10. 3. Losing your mucus plug and bloody show. This one might sound a little gross, but it's a big sign. The mucus plug seals off your cervix during pregnancy to protect your baby from infections. As your body preps for labor, this plug loosens and may come out as a jelly-like discharge. Sometimes, there's a little blood mixed in. This is called the bloody show. If you notice this, your cervix is getting ready for the big event. 4. Digestive changes and diarrhea. Your body has its own way of clearing things out before labor, literally. Hormonal changes can lead to loose stools or even diarrhea. It's your body's way of making room for your baby's journey out. So, if you're suddenly spending more time in the bathroom, labor might be closer than you think. 5. Intense nesting urge. Have you suddenly felt the urge to clean everything? This is called the nesting instinct. Many moms report a surge of energy and an overwhelming need to organize, decorate, or even deep clean their entire house. If you're scrubbing the floors at 3 a.m., your baby might be preparing for their grand entrance soon. 6. Lower back pain and menstrual-like cramps. As labor gets closer, you might experience lower back pain or cramping that feels like period pain. This happens because your cervix is softening and preparing for dilation. If the pain starts coming and going in a pattern, you might be closer than you think. 7. Increased pelvic pressure. As your baby moves down into position, you may feel extra pressure in your pelvis and hips. Walking might become more uncomfortable, and you may notice the infamous pregnancy waddle. If you're feeling extra heavy down there, it's a clear sign your baby is getting into place. 8. Water breaking. Unlike in the movies, when your water breaks, it's not always a huge gush of fluid. It can be a slow trickle too. This means your amniotic sac has ruptured, and labor is usually right around the corner. If your water breaks, call your doctor or midwife ASAP. 9. Cervical dilation and effacement. Your cervix needs to thin out, efface, and dilate, before your baby can be born. During your last checkups, your doctor might tell you how many centimeters dilated you are. Some women walk around at 2-3 centimeters for weeks, while others progress quickly. 10. Regular, intense contractions. This is the biggest sign that labor is here. Unlike Braxton Hicks, real contractions get stronger over time, come at regular interval, last longer and don't go away when you move. Once your contractions are consistently 5 minutes apart, lasting 1 minute, for at least 1 hour, it's time to grab your hospital bag and go. So there you have it, 10 signs that labor is near. If you're experiencing a few of these, it might be time to get ready to meet your little one soon. Comment below which signs you've noticed, and don't forget to like, subscribe, and hit that bell so you don't miss more helpful pregnancy tips.